please welcome the gene therapy group.
Hello, I am Matthew. This is Hannah, Emily, Aaron, Danny, and Jasmine, and we are doing gene therapy. Gene therapy is a revolutionary and interesting subject that me and my colleagues are going to tell you about today. What better way to start out than with the definition? Gene therapy is the insertion, deletion, or substitution of genes, but not by natural mutation, but by human manipulation. Manipulation seems like a harsh word, but in gene therapy, it is amazing. Before we learn of what it can be used for, how about we start with some history? In 1960, an enzyme was found that could transfer gene sequences. With the information, tests ensued, such as Stanfield Rogers in 1970. In 1990, the first official gene therapy test was done on Ashanti De Silva, a 4-year-old with adenosine deaminase deficiency. Although she was not cured by gene therapy, she lived a longer life. But 9 years later, the death of a Jesse Gelsinger was a major setback to the gene therapy research, and many laws and other precautions were put into place. Now that history is out of the way, we can now learn about its uses. Gene therapy is the pathway to finding more cures to genetic diseases. Right, as of right now, the only cures and treatments that can be found using gene therapy are related to blood and stem cell diseases. But in the future, with enough research and more information, gene therapy can cure diseases such as ALS, cancer, and other miscellaneous diseases. Gene therapy is a doorway into the future of genetic cures, and there's one question to ask. Will you be the one to open the door?
Although gene therapy is still at its infancy age, there have already been breakthroughs in technologies and programs that have been set in place to further regulate the safety of gene therapy. One of these agencies is NIH. It is a biomedical research facility located in Maryland. It is the primary agency for the U.S. government that is responsible for biomedical and health-related research. The BOA which stands for the Biomedical Office of Activities, is the main section of the NIH that deals with gene therapy. And it develops policies based on biosecurity and biosafety in the conduct of clinical trials. As you see on the graph, cancer is the mainly targeted disease because there's no known cure. So the other two that are mainly targeted are also diseases that pertain to cardiovascular and infections. There are two main ways in conducting these clinical trials, and the two main ways are germline and somatic therapy. Germline therapy is the adding or subtracting of a gene within DNA of an individual's sperm or cell, and when doing so, it is passed on to the offspring. The second way is germline therapy. Germline therapy is the adding, fixing, or removing of a gene inside of one cell. The difference of this and germline therapy is the cells that are targeted are the only ones affected, therefore they're not passed on to the offspring.
Although gene therapy is a promising new medical technique, the public has not been given enough information to understand this new process, and this has led to confusion, disinterest, and even rejection regarding gene therapy. This lack of education discourages people from participating in clinical trials, which are essential to the growth and development of gene therapy. As you can see on the graph, the percentage of healthy volunteers that participate in clinical trials is only about 2%, which is extremely low. Once people are educated and understand the process and the risks and the benefits of gene therapy, the more willing they will become to participating in these clinical trials, and this percentage will hopefully
informed or educated much on this topic. So our proposal is that we inform and educate the public. By inform, I mean to tell them about gene therapy, how it can help people, and that it's not like we're not trying to change how people work. We're just trying to get rid of genetic diseases such as cancer, diabetes type 1, and others. And then step 2, to educate. What we mean by this is once we inform them of what this is, we plan to educate them further in this topic so they know exactly what's going on. So we'll educate them about the risks, the benefits, and everything else that they need to know before they completely diverge themselves into this. And we plan to do this for 4 years.
What we plan to do with the money that we obtain is we would like to conduct electronic surveys so that we can find out what people already know about gene therapy and what they think about it. Do they think it's immoral, dangerous? Then use the information that we gather from those surveys to find out what we need to still let them know about it through our other things. Like we plan to get 3 large billboards near different cities such as Los Angeles, Chicago, New York. We plan to conduct radio ads to teach people about gene therapy and get the science-related program TED Talks to talk about gene therapy. As you can see here, we are asking for $800,000 for 4 years, and we're going to get that from the Alliance. Not count the we hope cancer gene therapy and the funding our future $150,000. We plan to get through various other donations and grants.
In conclusion, gene therapy is fairly new. It first came around in the 1960s. Although there are only a few ways to conform it, with more information and getting more people on board, we can have more research and more people on board to support the research in order to have it done. With cancer being the #1 leading that it is used for, because more people are aware of it and not aware of all the other diseases and genetic therapy. Disorders that gene therapy, and the first FDA approved gene therapy treatment was performed on 4-year-old Ashanti De Silva in 1990. Ashanti De Silva was born with a genetic disorder called ADA-SID, which is a severe immune deficiency disease that made her more vulnerable to the slightest infections. Infections that someone with a healthier immune system it wouldn't affect or cause any sickness or anything to them. With her having this deficiency, she was able to get sicker easier, and at 4 years old, she was very sick, and it caused her to more likely have a premature death. The cause of this was because she was born with this single genetic disorder that did not produce an enzyme for her immune system. She went through gene therapy, and it helped her get through her sicknesses, and it did not cure the disease, but it helped her produce that enzyme, but it did not give a rise to new cells for it to keep going. Today, Ashanti De Silva still periodically goes through gene therapy to maintain those levels, and she also takes by the FDA. That is 2,000 lives that have been dosed of saved through gene therapy of people who had genetic disorders. If we can further educate the public and get more people on board, they'll be more willing to fund us, and that's more lives that we can save.
Questions? Mr. B.
So how do you avoid, I think, the problem, you guys mentioned it, but how do you avoid the problem that this is genetic modification on its most basic level? It's not necessarily right from the get-go, but it is genetically modifying humans in a way. I guess, how do you avoid those comparisons being made while you're also trying to tell people the benefits of this treatment?
Well, you have the GMOs like plants and animals, and we normally use that for longer lasting foods and stuff, which I guess people fear because they think it can cause mutations. With gene therapy, by informing and educating the public about it, we can show them how we're saving lives and not like harming them.
So just as long as people know more about the basics, then you could avoid maybe the problem that come up with that.
Yeah, that's what we think. Any more questions?
Other questions? All right, thank you.